Well, what usually begins is someone will start out maybe being a little bit more forgetful than normal. And as we get older, forgetfulness, benign forgetfulness, is part of normal aging.
Exactly.
But the forgetfulness becomes more and more pronounced, and it becomes more and more obvious. Their ability to perhaps, they always did maybe they did the bill role in the family.
Right.
And the bills come in and either they get paid twice or
Yes.
they don't get paid at all for 2 or 3 months.
Right.
And you start noticing those things are slipping.
Right.
The tea kettle is put on, it boils and boils, it boils dry,
Right.
and the person didn't even remember turning on the stove. Those things start indicating to you that someone is still driving and they get lost, going to a very familiar area, something that is just not right. And that should be an indication, that's a pre-diagnosis, that's an indication that that person needs to be looked at by a healthcare professional. They may have a mild cognitive impairment. It's not even a dementia. It's just a mild cognitive impairment. But we find people with mild cognitive impairments, 10% of them will probably convert to a dementia within a year.
Right.
So not all of them, but some of them will. So it's good to know what it is that's going on. Once we have the diagnosis, then that takes the relationship to another level. Oh, there's a reason. And with an early stage Alzheimer's, the person can still, or any early stage of a dementing illness, they're usually still safe to live in the community with some supports. They cannot live in a healthy manner in the community without any supports at all. They do need some supports. Can they still drive? That, sometimes they can, if somebody else is with them in the car. And you often notice that when a husband and wife have been together for years and years and one of them had a dementing illness, the family may not ever have been aware of it until the well spouse expires, because the well spouse was that person's memory.
Exactly.
And held it together for them. But as soon as the well spouse was out of the picture, it became very obvious what the other person's deficits were. But with all of the deficits that happen in the early stages and the later stages, the losses that we have, there are still residual strengths. As I was saying to Bert before, I'm a glass half full person.
Right.
What you have to look at is not constantly look at what are the deficits, what are the losses, but what still remains of that person. How can I continue to connect with that person? And that's what's important.
And having someone come in and assess, safety, assess where you are with it, where your loved one is with it, and to be able to let you know there are a bunch of resources out there, because you can take weeks and months finding about all of this along the way by accident. When we're right there, we're here, we're there for you, we're able to say, look, these are some of the things you're going to have to change. These are some of the things you need to be prepared for, and some of the decisions you're going to have to be making. And one of the things that you said, and I don't want to lose that point, is that yes, you probably can give the best care because you know her so well. But you're going to have to be able to trust that there are other people that can take that on. And it has to do with the love of who that person still is. That
What's
soul,
left of that
right?
person.
And that
Yes.
connectedness, because they need that connectedness still.
Sure.
When you think about what they're going through, everything is changing around them. There are people coming in the house that look familiar, but why can't I put a name on them anymore? But there's that connectedness, that love that you and she have is still there.
We also have to remember as caregivers that Alzheimer's disease, yes, is the most common condition leading to dementia, but there are over 59 other conditions. There is Lewy body dementia, there's vascular dementia, there's frontotemporal, which is Pick's dementia. There is Parkinson's with multiple sclerosis.
Right.
There can be a dementing component. With HIV,
Yes.
there are just there are a vast number, and they're not all the same. If somebody becomes very, very agitated, with Alzheimer's disease, and it's indicated to have some sort of medication to calm that person down so that they're not so agitated. You can do that with Alzheimer's disease with antipsychotics in very small doses. You do the same thing with Lewy body dementia, and you can put that person in a catatonic state. It is extremely dangerous to use antipsychotics with Lewy body dementia. So not only is it important to identify that this person is developing a dementing illness, but also what type of dementing illness, if at all possible, so that we know how to treat it. No one wants to see their mind leaving them.
Exactly.
And these people, their cognitive abilities are declining, but they're still there emotionally and spiritually, and they know that something's going wrong, and it's very upsetting. So if there's anything we can do to make them feel better,
Exactly.
it's very important,
Now,
not only for them, but also for us as caregivers.